Okay, I'm going to go over different type of blood tubes that are used in everyday clinical practice in veterinary medicine. This is the lavender top or purple top tube that contains EDTA, which is an anticoagulant. Once you fill it with blood, you need to invert it to activate that anticoagulant, and this is used for CBC tests, Coombs test, and reticulocyte counts, basically tests when you need to analyze the blood cells themselves, and only less than 1 ml of blood is needed. When it's in the tube, it's going to look a little bit like the picture on the bottom where the red blood cells are at the bottom, and then there's the buffy coat, which has the white blood cells and platelets, and then the plasma, which has all the clotting factors, are on the top. This is the red top tube that has no additive in it. So you put the whole blood in and it clots naturally because there's nothing to separate those clotting factors. And then you centrifuge the tube and you can separate the red blood cells from the serum. You can use this blood for organ health panels, blood chemistries, and to test drug levels. You do not need to invert the tube once the blood is in there, and you need about 1 to 6 mils of blood. This is a red marble tube, or sometimes known as a tiger top tube. It has a clot activator and a gel for serum separation. The blood in here will clot faster than the plain red tubes, but you still get the same thing of serum on the top and then the red blood cells at the bottom. The gel helps prevent remixing after centrifuging these tubes, so it's really good for shipping purposes if you're sending it out to a lab. It's used for chemistries, renal panels, thyroid panels. You can't do drug tests with these though because of the additives in the tube. You need about 1 to 6 mils and you have to invert to activate. This is the beautiful but oh so frustrating sodium citrate tubes. They're used for coagulation tests, but you have to fill the blood to that exact line, no more or less, or the tube is basically useless. And you have to invert it immediately, roughly about 8 to 10 times after filling. The last tube is the sodium heparin containing tube with a green top. It has an anticoagulant and it's used for pH, ionized calcium, and blood gas tests. It requires a small amount of blood, about 0.3 mils. You invert it upon filling, but another type is a lithium heparin, which is known to be a bit more accurate for testing purposes. So whole blood, plasma, serum, what is the difference? Whole blood is the red cells, the plasma, the platelets, and all the clotting factors. Plasma is just the liquid portion of the blood. It's about 90% water, and it contains all those nice clotting factors like fibrinogen. Serum is basically plasma without the clotting factors and the red blood cells. Remember, in the red top tube, it's going to be the red blood cell clot at the bottom, so it has the clotting factors, and then the serum is just the fluid that's floating on the top. You have to get serum after the blood coagulates. Once all those clotting factors are at the bottom, you get plasma before the blood coagulates. So basically you need to use something that has an anticoagulant in it. And then you do not use anything with an anticoagulant to get serum.